And then more recently, I've got interested in the carnivore diet. And for many people, the carnivore diet is the quickest route to recovery because it addresses so many causes of disease, because it's low allergen. You can be allergic to meat, but it's unusual. It's very low carbohydrate, so that sorts out the problem of the upper fermenting gut, which we could talk about all day, should you so wish. It's a low toxicity diet, and that's very important. If you look at life from the point of view of a vegetable or a plant or a seed or a nut or whatever, a grain, it doesn't want to be eaten. It doesn't want to be attacked by bacteria, viruses, and yeast. And so it makes itself as poisonous as it possibly can. Now, humans have a fantastic liver, which does a great job of detoxification, but our livers are overwhelmed by poisons at the moment. We're all poisoned by pesticides, by volatile organic compounds, by heavy metals, and the liver just cannot cope with the total toxicity that's presented to it. So it's a low toxin diet because it's free from plant matter. And for many people, that is the most frictionless route. And as I was developing these ideas, of course, that was not liked by establishment medicine.
Sarah, could you tell us about your health journey and how did you discover low carb and carnivore?
Okay. Well, I qualified as a doctor, as a conventional doctor in 1981. And for 20 years, I worked in the British National Health Service. And, I qualified out of medical school, top of the year, and went into general practice thinking I knew it all. And within the first few surgeries, I realized I knew nothing. I knew nothing because what we had been taught at medical school was symptom suppression with drugs. And what people really wanted to know was, why have I got this problem? And so I started, trying to address the question why. And initially, my ploy would be, oh, well, let's do a blood test and then, and come back next week. And by the time they'd come back, I'd thumb through all my textbooks. I phoned a friend and I still didn't know the answer. And so that's what really kickstarted my journey into asking the question why. Because the point here is, if you know the mechanisms of disease, if you know why somebody has got symptoms or disease, then that has obvious implications for management. And early on in proceedings, I realized that diet was a huge player. It was a huge player for reasons of allergy, upper fermenting gut, toxicity, et cetera, et cetera, et cetera. And initially, my interest stemmed from allergy. And the classic diet there was a lamb, pears, and rice diet, which did it for some. And then I had a few people who got stuck on that diet and couldn't, expand it. So I realized that was not a good starting place. So then I evolved into the Stone Age diet, which cuts out the gluten, grains, and the dairy and the yeast. And then I realized that for many, that wasn't doing the trick. So then I evolved into the Paleo Stone Age diet. So that was no low gluten, grains, no dairy products, no yeast, and very low carb. And then more recently, I've got interested in the carnivore diet. And for many people, the carnivore diet is the quickest route to recovery because it addresses so many causes of disease, because it's low allergen. You can be allergic to meat, but it's unusual. It's very low carbohydrate, so that sorts out the problem of the upper fermenting gut, which we could talk about all day, should you so wish. It's a low toxicity diet. And that's very important. If you look at life from the point of view of a vegetable or a plant or a seed or a nut or whatever, a grain, it doesn't want to be eaten. It doesn't want to be attacked by bacteria, viruses, and yeast. And so it makes itself as poisonous as it possibly can. Now, humans have a fantastic liver, which does a great job of detoxification, but our livers are overwhelmed by poisons at the moment. We're all poisoned by pesticides, by volatile organic compounds, by heavy metals, and the liver just cannot cope with the total toxicity that's presented to it. So it's a low toxin diet because it's free from plant matter. And for many people, that is the most frictionless route. And as I was developing these ideas, of course, that was not liked by establishment medicine. It was not liked by established medicine because I didn't need to prescribe prescription drugs. And that meant my prescribing budget was extremely low. And because my prescribing budget was so low, I was admonished, must be a bad doctor, she's not prescribing any drugs. So in 2000, I went independent. And from the intellectual and the moral side of things, that was the best thing I ever did. From the financials point of view, it was an absolute disaster, of course. But I didn't have the clinical freedoms I needed within the NHS to practice, to be a good doctor, to be an effective doctor. So that's when I went independent, and I have enjoyed my medicine so much as a result. And what's so fascinating is many of my colleagues, who are, gone down the conventional route, they can't wait to retire. They're demoralized. They haven't got the freedoms to be good doctors. They daren't speak outside the official narrative for fear of being struck off. Whereas I'm enjoying my medicine. It's good fun. I'm learning new things every day. And the carnivore diet has been a massive addition to my armamentarium. So that's why I got into carnivore.
That's awesome. And I was thinking this morning, if anyone does a Google search, looks on social media about you, often what comes up is the most investigated doctor in the UK, which is, I don't know how you feel about that, but is that a good thing or a bad thing?
Well, initially I was horrified when I was investigated by the General Medical Council, because it's not good for one's professional reputation, is it? But there's never been a patient complaint. All the complaints have come from doctors, from health authorities, from the GMC itself, because they simply don't understand this sort of medicine. But it's worse than that. It's worse than that, because the General Medical Council is conflicted. It's got massive investments in big pharma, and therefore it looks after self. And if the whole world, and that would be a wish, if the whole world would eat and live lives like you and I are, a good quality diet, few supplements, detox regime, we wouldn't need drugs anymore. And that would be a disaster for big pharma. We wouldn't need, the Voldemort factor, as I call it anyway. We wouldn't need the V word, and we would live lives to our full potential in terms of quality and quantity. And of course, not only do big pharma not want that, but big government doesn't want that either. What big government wants is it wants peasants like you and me to work their little hearts out on the back of addiction, sugar, nicotine, alcohol, drugs of addiction, until we get to our pensionable age, and then drop dead because they haven't got the pension funds to look after us. So, So addiction, many addictions are taxed. Of course, the one addiction that isn't taxed and should be is sugar, but alcohol is heavily taxed, cigarettes are heavily taxed, etc. So they make a fortune at that, and then they don't have to pay us a pension scheme. So it's good money for big pharma and big government, isn't it? We have to escape that horror.
Yeah, absolutely. Yeah, it's fascinating. The more I'm learning about nutrition and questioning what we've been taught and listening to podcasts like yours and reading, it's just it's almost unbelievable. And then, as someone like Gary Vecchia would say, once you see it, you can't unsee it.
Correct. And the point is, it's logical. It's within everybody's grasp to do. I don't say it's cheap, but compared to being ill, it's inexpensive. And the thing is, it's incredibly powerful. People think, oh, well, I'll have the drugs because that's what really does it. And okay, if all that fails, well, I might have a go at something else. But if you get all these lifestyle things in place, diet, exercise, sleep, sunshine, all these important things, then this is what our health demands. And we can stay fit and well for decades. We don't have to, crumble into an ancient old age with arthritis and pain and misery and drugs and all that. It's just not necessary.
Yeah, absolutely. And it's funny, the longer I'm on carnivore, the better I feel. And I think once I hit the age of 35, I was noticing getting these aches and pains when I wake up in the morning. And I thought, that's not good. Am I looking at the problems of old age already? But I think since taking out the vegetables and the sugar, those aches and pains have gone, which is very surprising.
But the lovely question we have to ask is, why have they gone? Now, a major driver of arthritis is allergy to microbes from the upper fermenting gut. Now, let me just explain this, because this is such an important issue. And if when we're asking people to do difficult things, they really have to understand why they're doing it. Because if they don't have the intellectual imperative, I think, oh no, I won't bother with that. I'll just go back to my old ways. Now, the gut is a tube. It starts at the mouth. It finishes at the anus. It's about 30 foot long. Now, the first 25 foot of that gut should be near sterile. No surface in the world is completely sterile, but it should be near sterile. The last 5 foot is the large colon, is the large bowel, where the microbiome resides. And yes, that does lots of good things for us. But the point is, the first 25 foot should be sterile. Now, if we overwhelm the body with sugars and carbohydrates, if we eat all the time and we never fast, if we're having breakfast, snacks, lunch, snacks, supper, snacks, the gut loses sterility. The microbes that we eat with food, because if you eat fruit, for example, basically you're eating a bag of sugar coated with yeast, and the gut cannot be sterile, then the food starts to ferment. Now, that is a disaster. It's a disaster for lots of reasons, but one part of that disaster is the microbes themselves start to live on the lining of the upper gut, which should be sterile. Where they live there's low-grade inflammation, and where there's inflammation, there's leaky gut. And where there's leaky gut, there's potential for those microbes to get from the gut into the gut wall, into the bloodstream, and they can get stuck at distal sites. And where they get stuck, they drive inflammation. So inflammation where they get stuck in the muscles is called fibromyalgia. Inflammation where they get stuck in the joints is called arthritis. Inflammation where they get stuck in the lungs is called intrinsic asthma. And when it gets stuck in the brain, that may well be the basis of much mental disease, anxiety, and psychosis. So these microbes getting into our body is real bad news. And it's bad news for other reasons as well. One of the books I've written is called The Infection Game. And as I was researching for that book, I suddenly came to appreciate that all chronic disease has an infectious associate, if not an infectious driver. So, all cancers do have an infectious associate. The one we all know about is Helicobacter pylori, of course, and stomach cancer. But, there are many other such associates. Dementia is often associated with viral infections, particularly the herpes viruses. Breast cancer is associated with Epstein-Barr virus. The hematological malignancies are associated with various human endogenous retroviruses. So keeping infection at bay is a really important part of long-term health and nasty pathology. And if you're constantly leaking microbes from the gut into your bloodstream, then you're inviting infection. You're asking the immune system to do a massive job. The immune system just gets overwhelmed by all that. So, keeping the upper gut sterile by dint of not feeding it with sugars and carbohydrates is a really essential part of health. And my guess, Todd, is that your aches and pains, your arthritis, was driven by allergy to microbes in the upper fermenting gut. And by dint of going carnivore, you starve them out, and bingo, the aches and pains settle down.
That's awesome. Yeah, because I've tried to tell friends and coworkers I'm not eating vegetables, but I feel better. They think I've lost the plot. It's quite amusing. Yeah.
We have been so indoctrinated. I mean, one of the bits of carnivore that kind of worried me initially was, what about the microbiome? And and if you'd asked me this question 2 years ago, I'd say, well, it seems logical that there are lots of different microbes in the gut, and they're all predicated on a particular food, and therefore the more varied is your diet, then the more varied the microbiome. Because we don't know much about the microbiome, but what we do know is the more diverse it is, the healthier you are. And then I stumbled on a comment by Professor Nick Lane, who's a professor of evolutionary biology, where he pointed out that bacteria and yeast, they might ferment one food, but then they produce a waste product that's fermented by another bacteria, which then produces a waste product that's fermented by another bacteria. So it's not a horizontal thing, it's a vertical chain. It's a little bit like the little ditty, big fleas have little fleas on their backs to bite them. Little fleas have lesser fleas, and so ad infinitum. You just go down the food chain. And what we forget is meat fiber. There is fiber in meat, which is a really important prebiotic for the two biggest or two most important class of microbes in the microbiome, which are Bacteroides and Firmicutes. And maybe that then they ferment that collagen and other meat fibers to produce other, amino acids or methyl groups maybe, or lactate groups, whatever, which other bugs ferment. Because the interesting thing is if you look at the microbiome of somebody on a carnivorous diet, it is just as diverse as that of a microbiome of somebody who's on an omnivorous diet. So I'm no longer worried about the microbiome. And the second question that so many people ask me is, well, won't you get constipated on a carnivore diet? Well, as I'm sure you've heard this quote, many of the carnivore people point out, adding fiber to somebody who is constipated is like putting more cars into a traffic jam. It's not going to do it. And I think constipation is a friction issue. I think constipation results when there's friction between the lining of the gut wall and the gut contents. So we then have to ask what causes that friction. And this brings me on to one of my other favorite subjects, which is fourth phase or exclusion zone water. Now, this is all work done by that wonderful, wonderful physicist, Gerald Pollack. And essentially, he was looking at, back to basics, back to water. And as we know, water can exist in three forms. It can exist as a solid, we call it ice; as a liquid, we call it water; as a steam, as a gas, which we call steam. But water molecules do something different against a surface, which might be a water-loving surface or it might be a water-hating surface. And essentially, it organizes itself into something called fourth phase on the grounds, 1, 2, 3, ice, water, and gas. Fourth phase water, which is the water molecules put themselves into a honeycomb-like structure. And this structure is remarkably stable. It's remarkably solid, so it's also called gel water. And what's so fascinating is if you tot up all the electrical charges involved, you end up with too many protons. And so it's called exclusion zone water because the protons are excluded. Now, apologies for that nasty explanation, but all you have to remember is that all surfaces in the body are negatively charged. And if they're negatively charged, then they will, like the railway system in China, maglev, which the train hovers on an electromagnetic field, so it's frictionless, and so it can travel at 1,000 kilometers an hour. Something else, isn't it? It's the same in the body. All surfaces are negatively charged, so they don't actually touch. They float over each other in a frictionless way. So when I wave my arms around like that, there's no kind of creaking or groaning or grittiness there. It's frictionless because it's all negatively charged. Now, for good quality exclusion zone water, yes, we need good water, we need good fat, we need some heat there because it's background radiation that drives this. But what makes that gel layer thick? And if it's thicker, it's more negatively charged and therefore it's more frictionless, are sulfur groups. Now, we are all sulfur deficient. Not my words, but the words of Stephanie Seneff. And meat is a rich source of organic sulfur. So as soon as you start to consume good amounts of meat and, of course, offal, and, of course, those tough, sinewy bits which are you chew off the bone and you end up boiling up in your beef stock and because you must waste nothing from an animal, then you suddenly have adequate amounts of sulfur in the body, and that reduces the friction, and that's going to reduce inflammation, because where you've got friction, you've got inflammation. Where you've got inflammation, you've got sticky blood. Sticky blood is there's a lot of friction there. So these three clinical pictures are inextricably intertwined, and what is the underlying factor is exclusion zone water and good quality sulfur. So meat is going to be very helpful as just high meat diet, high fish, high eggs, because it's going to reduce friction in the body. And that's going to be massively helpful for a multiplicity of reasons.
Gotcha. That's awesome. You mentioned cancer before. I know it's not very pleasant. People don't want to talk about it, but I'm curious. The more I'm hearing about it, like, what is actually the root cause of cancer, and is there a way to put it into remission without resorting to things like surgery and chemotherapy?
Okay. Well, the fact of the matter is we are all throwing up cancers all the time. Just from background radiation alone, let alone modern pollution, forget electromagnetic pollution and heavy metals and all else, just from background radiation alone, that generates 10,000 mutations every second. So we are damaging our DNA constantly. And, sometimes just through, chance, you will damage your DNA in such a way that you will throw up cancer cells. So, the immune system is constantly on red alert. It's going around, identifying those cancerous cells, those dead cells, those cells that have worn out, and gobbling them up. And that's called, in a process called autophagy. Now, what characterizes cancer cells and what makes cancer cells different from normal cells, and we have known this since the 1930s, thanks to the work of a wonderful German physiologist called Otto Warburg. Cancer cells can only run on sugar. Now, as they mature and later on, they can actually run on glutamine, but that comes later. But in the early stages, they can only run on sugar. So if we're producing cancer cells all the time, and then we're feeding them with sugar, guess what? They're going to grow very quickly. And if the immune system is less than perfect because it's deficient in something, it hasn't got the energy, it's been poisoned by something, then that's going to be going slower. And all of a sudden you get to a tipping point when the immune system cannot mop up all those cancer cells as fast as they are evolving, and suddenly you have a tumor. Now, by the time, so obviously the way to prevent cancer is A, stop feeding them sugar. And guess what? The carnivore diet is a low sugar, low carbohydrate diet. And B, look after your immune system. Feed it some basic vitamins and minerals and essential fatty acids. Stop poisoning it with chemicals and heavy metals, and you will be cancer-free for life. But of course, people don't come to me saying, I don't want to get cancer. And that never happens, do they? They come to me too late when they've got cancer. And when they've got cancer, then obviously they've lost, or they're starting to lose the battle. So yes, of course, when you've got a cancer, what you have to do first is reduce the numbers of the enemy. So that's where surgery to remove the lump, radiotherapy to reduce numbers, or maybe chemo for some of the malignancies can be very helpful to reduce the total load. But what kills people is not the primary cancer, or it's rarely the primary tumor, it's the secondary spread. So getting a cancer should be a real wake-up call, because we can massively reduce chances of spread to other parts of the body. And at that point, people have to really wake up and do the diet in spades. If it's an advanced cancer, you have to think about glutamine as well. But the priority is to do a ketogenic diet. And normally for normal everyday use, nutritional ketosis, running ketones between this is blood ketones between 0.5 and 1 millimole per litre is sufficient. For cancer, I like people to be running their blood ketones between 2 and 3. They've got to be much more disciplined about their diet and ruthless about the sugar. And the carbs. When I say to people, every time you have a little bit of carbohydrate or a little bit of fruit, a little bit of sugar, you're just feeding that cancer. You're killing yourself. And if people can get that association in their minds, then it makes the whole business of going PK so much easier. And for many, a carnivore diet is a great start. Now, as I mentioned, not my words, but the words of Thomas Seyfried, who's a brilliant oncologist, with a more advanced cancer, they can start to live on glutamine, which is an amino acid from protein. So we don't want to go mad with protein. So the carnivore diet needs to be a normal protein diet. And you might think, well, that's tricky on a carnivore diet. You get your calories from fat. Remember, again, whenever you have a difficult question, what should I eat? Where should I go? Always go back to evolutionary biology. And primitive man and primitive woman thrived on hunting large herbivorous animals like bison, like buffalo, like mastodons, like elephants. And they've got a lot of fat on board. And fat is the most perfect food. It's energy dense, it needs minimal digestion, it powers us, for long periods of time. We can store it in the body, and that allows us to survive winter. So your carnivore diet, when you've got an advanced cancer, needs to be high in fat. And there are some lovely high fatty foods like lardo. Have you ever had lardo? It's the most delicious salami. It's a salami which is pure fat. It's made from the margrizza pigs, which is a margrizza pig, which is an Italian pig that's famed for its ability to lay down thick layers of fat. I'm very lucky here. I've got kuna pigs, which of course are a New Zealand pig. And again, they too lay down, thick fat. So my salami is just the most delicious in the world because it's fat dense and all the flavor is in fat. If you're cooking, you ask any good cook And they want to cook with meat fat, beef fat, pig fat, lamb fat, because it's so delicious. And of course, the reason it's so delicious is taste has evolved. Taste has evolved to guide us towards the most nutritious foods. And fat is the most nutritious food you can eat. So the diet for cancer, or for preventing spread of cancer, is absolutely centrally important. And there are so many studies showing that people who stick to these regimes, their survival is so massively improved. You're probably aware of a lovely, fascinating young man called Andrew Scarborough, who 10 years ago was diagnosed with a glioblastoma. Now, a glioblastoma is one of the nastiest tumors you can get. The normal survival is about 15 months, 18 months if you're lucky, with all the surgery, chemotherapy, radiotherapy, or whatever. Now, in parallel with his glioblastoma, he had severe epilepsy. And all the drugs in the world, didn't control it. Now, we've known for decades that you can reverse many cases of epilepsy with a ketogenic diet. So he thought, well, that's what I'm going to do. I'm going to do a very strict ketogenic diet. And bless him, he was incredibly tough. He was incredibly strict with his ketogenic diet. He also reduced his protein. So he was having 1 gram of protein per kilogram of body weight. So that's a pretty low protein diet. But as I say, it was a very nasty tumor, but he got off all his epilepsy drugs. He had no further surgery, radiotherapy, or chemotherapy. And here he is 10 years later, functioning at a high level and living a normal life. Now, that is an astonishing case history. And the shocking thing now is that medical research is now so driven by big pharma. It's so skewed by poor statistical analysis that much of that research is worthless. And the only research we can really, really believe is the evidence of our own eyes, case histories like that, which are, I find, absolutely riveting and inspiring. And as we speak, I have a man who I'm treating with glioblastoma, and already he has seen improvements simply by doing a pure fat diet. It's very, very early days yet, but it's hugely encouraging. So the carnivore diet really is the starting point and the finishing point to treat, many, many conditions, including cancer.
Gotcha. Yeah, that's awesome. And it all makes sense, because those foods that are most delicious to me, it's like fatty red meat, eggs, fatty fish, like those are the foods that I really crave. But we've been told, oh, you shouldn't eat too much fat, you'll get cholesterol. You shouldn't eat too many eggs. Like, it's just this marketing we've been told again and again, right. and people have to believe it. Correct. And people who are not thinking like you and I, we call them asleep, aren't they? They are asleep. They're sleepwalking into a short life where they will get degenerative conditions early. I just heard a statistic recently. I live in Wales, and the Welsh government has come under criticism because the average age at which a Welsh person develops some sort of life-threatening or life-impactful disorder, which might be severe depression or arthritis or cancer, is 60 years old. I mean, that shocks me. I'm 67. I don't have any of that stuff, which means there's somebody age 53 who's getting it then. In fact, a case in the paper recently of a young girl who saw about 15 doctors before her colon cancer was diagnosed, and she's 23 for colon cancer. I mean, when I qualified, in the early 1980s, that was a disease of people in their 60s and their 70s and their 80s, generally speaking. So for a 23-year-old, that just illustrates, what a poor environment we are now living in terms of food, toxicity, electromagnetic radiation, and all else. But as I keep saying, this is all within the power of us all to turn around and change. And it won't come from top down. It won't come from top down because big pharma and big business and big government are making too much money at it. This has got to be a grassroots revolution. And that's why I welcome having podcasts like this with peasants like you and me, because this has got to be I can be very rude sometimes, Todd, you'll have to forgive me, but I include myself in the peasant category.
I shall spend this afternoon, or this evening, mucking out my pigs. So I'm very good at shoveling the proverbial SH1T. But this has got to be a grassroots revolution. It's got to come from below. And it's education, education, education. We have to teach people to wake up and then demand the good foods. Now, on the point you made about taste, and the good foods taste good, that is absolutely true. But many people say, oh, but my pizza tastes good. Oh, but my white bread tastes good. But that's not taste, that's addiction. And many people are not content with a meal until they've had an addictive hit. So they can have a lovely meal, roast meat with a few green vegetables or whatever, but they're not satisfied until they've had that tiramisu for pudding, those meringues, that cake, that chocolate. Until they've had that carb hit, they're not satisfied. Now, that is not taste. That is addiction. So it's really important when people start thinking about this diet to tease apart those two threads, what tastes good and what they're doing for an addictive hit. And then they start to appreciate what tastes good.
That's awesome. Yeah, that's a really good point. I like how you phrase that, taste versus addiction. It's two completely separate entities. Yeah. I wanted to ask you about iodine. Is there a way you can test for yourself if you're iodine deficient, and do you know how much you need?
You don't have to test because we're all iodine deficient. And iodine is such a safe tool. It does so many good things. Contact kills all microbes. So it's a great treatment for the upper fermenting gut. It helps protect us from getting infection. In fact, I'm going to show you one of my favorite tricks. As I mentioned earlier, we now know that infection drives a vast amount of pathology. It's associated with cancer, heart disease, and dementia. So what we want to do is stop little wretches getting in the first place. Now, 90% of infection comes in through the mouth, either because we inhale it or because we swallow it or we drink it. Now, that is swallowed and drunk should descend into an acid bath of the stomach. And when I say acid, I mean extremely acid, maybe pH 2. And a pH is a logarithmic scale. It's very acidic. But many microbes get in because we inhale them. They get stuck in our nose, they get stuck in our larynx, in our pharynx, or our chest, and there they can trigger infection. So at the first hint of any respiratory infection, a bit of a sneeze, a bit of a sniffle, a bit of a cough, you know what it's like when you get that tickling, oh, I know I've got a cold coming, is you sniff iodine. Now, I use Lugol's iodine, 15% Lugol's iodine, which is very cheap. That bottle will last you months, and it costs about £7. And this is a salt pipe. It's merely a delivery system. So there's holes at the bottom. I hope you can see those. There's a mouthpiece at the top. I hope you can see that. And if I shake, you can hear the salt in there. So what you do is you put a couple of drops of iodine in the mouthpiece. So I hope you can see that. So a couple of drops, 1, 2, like that. Whoops, missed. Give it a little shake and then sniff it. Don't inhale. If you put it in the mouth, it makes you cough. But I suggest putting the finger and thumb over the mouthpiece like that, and then a good sniff like that. If you sniff it, you're drawing it right down into your lungs. Now, iodine contact kills all microbes at 10 parts per million. It's a fabulous antimicrobial. There is no virus, no bacteria, no yeast that is resistant to iodine. And I now have 5 patients with bronchiectasis. Now, bronchiectasis is chronic lung infection. And the normal case history is they go from one infection to an antibiotic, to another infection, to another antibiotic, until they end up with an MRSA, a multi-resistant Staphylococcus aureus. And then they're in big trouble. Now, since doing ketogenic diets, and some of them are carnivore, and sniffing iodine, their need for antibiotics has gone to 0. They don't need them anymore. And they can do much more. They're fitter, they're healthier because they've got better lung function, and it's cheap, simple, and effective. One of these is actually a GP who goes to the Brompton Hospital, which is our big kind of, respiratory hospital in London. And a chest x-ray showed calcification, which said, oh, could that be tuberculosis? But then they said, well, since you're doing so well, we're not even going to investigate it further or treat it because clinically you are so well. So at the first hint of any cold, flu, COVID, whatever, sniff the iodine. Ooh, I'm a bit addicted to the smell of it. I love it. And that massively reduces the loading dose of infection. Now, if you reduce the loading dose of infection, you give the immune system a chance to get ahead of the game. So you don't destroy natural immunity. You do, the immune system does get educated. It sees the virus. It learns to recognize it. It has plenty of time to nip it in the bud. But the thing is, you don't go on to get, 2 weeks of flu or bronchitis or pneumonia or whatever. You just reduce the loading dose. And not only do you stop yourself getting that nasty flu or whatever, but you also protect yourself from getting maybe protect yourself from getting heart disease or cancer or some other nasty. Sorry, I've just realised that it's getting a bit dark here, or some other nasty infection, which might be Epstein-Barr virus, it might be cytomegalovirus, who knows? But COVID, for example, we know is a nasty little virus. If you've got a good immune system, it won't kill you. But if it gets stuck in your body, we know it can drive long COVID, and we're seeing a lot of that at the moment.
So even in 2025, you're still getting people with long COVID. That's incredible.
Oh yeah, absolutely. And the shame thing is, much of it follows the V factor. It's not just the infection that causes it. It's the so-called preventative Voldemort factor, as I call it, and we know that is driving many cases of long COVID because it's creating inflammation in the body. So if you inject somebody with the jab, then what you do is you turn them into a manufacturer of spike protein, because the messenger RNA gets into cells, it hijacks the cell's machinery for creating DNA, and that cell starts to generate and produce spike protein, which is one of the most pro-inflammatory things you can do to the body. And wherever that spike protein ends up, it's going to drive inflammation. And that might be inflammation of the lining of blood vessels, which causes inflammation in the blood, in the heart causes myocarditis, endothelial blood vessel, lining the blood vessels, endocarditis. What's the word? It won't come into my head. But anyway, inflammation in the blood vessels and throughout the body, arthritis, fibromyalgia, etc. It's a very pro-inflammatory particle, which we can do without.
Gotcha. And is it possible to get iodine from whole foods as well? Like, are there any particular foods that are high in iodine you'd recommend?
There's just not enough there to be of any use, really. I mean, there's some in seafood. That's the obvious place where you find iodine, but you just cannot get enough from a normal diet for optimal function. You see, we can use nutritional supplements in 3 ways. We can use nutritional supplements in tiny doses to prevent a deficiency. So let's look at vitamin C, for example. The government recommended daily dose for vitamin C is 30 milligrams a day. That will just about stop you getting scurvy. If you want optimal biochemical function, you need grams of vitamin C. I like people to take 5 grams a day. Again, not my words, but the words of Linus Pauling, very clever physicist. He won 2 Nobel Prizes in his own right. He was only beaten to a third by Watson and Crick. He devoted the last third of his life to orthomolecular medicine, the right molecular molecule, the right molecule. He pointed out, if we give the human body the right molecules, it can look after itself. And one of those right molecules is vitamin C. Now, it's humans, fruit bats, and guinea pigs that cannot make their own vitamin C. They are reliant on their diet for that. And what's interesting is the carnivore diet provides good, reasonable amounts of but very bioavailable vitamin C. But if you look at other animals like sheep, pigs, horses, dogs, they can make their own vitamin C. And if you scale up from what they make for themselves every day, Linus Pauling came to the view that we need about 5 grams a day. So that's what I take, rounded teaspoon of ascorbic acid every morning. But we can then use ascorbic acid in super high doses to treat pathology. And that's called taking vitamin C to bowel tolerance. And in cancer, this is really, really, really important, because animals can make their own vitamin C from sugar. It's a 4-enzyme step. But what that tells us is that vitamin C looks biochemically a little bit like sugar. So if somebody's got cancer, if you starve them of sugar by dint of doing a carnivore ketogenic diet, and then you feed them big doses of vitamin C, the cancer cells think, oh, that looks like sugar. We'll take that up. We'll take that up as a fuel. And they take it up as a fuel, but the vitamin C kills the cancer cells. So vitamin C in parallel with a ketogenic, low carbohydrate diet is a very powerful anti-cancer weapon that we should all be employing. And what I'm saying to people is, don't wait till you get cancer. Do it now. It's cheap, it's simple, it's effective, and it does lots of other good things as well. It helps us to detox heavy metals. It helps to kill any microbes in the upper fermenting gut. It's a vital antioxidant for the body. We all know vitamin C is good stuff. So vitamin C and iodine are two of my favorite multitasking tools for keeping infection at bay.
That's awesome. I had a question about like black coffee on carnivore, or if you're ketogenic. Is that good or bad?
It's a question of degree.
Okay.
And small, modest amounts of coffee. You see, coffee is obviously, it's a drug. It's a very pleasant drug, of course. It gives us a hit of energy. But like any addiction, if you have too much, you need more and more and more to get the same hit. So the way to use coffee is to reserve it for those occasions when you really need it. And then you just have a little cup, to give you that hit. And that can be, very helpful to get us through life. Because guess what? Life doesn't arrive in nice, easy, manageable packages, does it? It comes in overwhelming. Oh, you've got to do this now. And oh, you've got to do that now. And the stress is on. If you have too much coffee, I think there are problems for at least two reasons. First of all, if I measure toxic metals in urine, people who are coffee drinkers, I often see high levels of rubidium. And I suspect that's toxic to the heart. Now, we know coffee, and I'm not sure if it's rubidium is the case, it inhibits potassium channels in the heart. And that's probably why ectopic beats and heart problems and dysrhythmias, can be triggered by caffeine and coffee. And the other point is it's got a very long half-life in the body, and that can disrupt sleep. And guess what? Sleep is awfully important stuff, because that's when we heal and repair. So what I suggest people, the way they manage coffee is have a little dose on a morning when you're going to be really busy and you've got to pull all the stops out. But don't do it every day, because you'll get used to it, and then you have to have more and more and more and more and more. So a little bit of coffee is fine. And what supercharges it is put some fat in there. And some people put a dollop of butter in there, and they call it bulletproof coffee, or a dollop of coconut oil, or some MCT oil. That's a very useful adjunct as well. And the point is the carnivore diet is a very good starting point. But what I then like to go on to is time-restricted eating. Now, we've touched on the reason for this already, because if you are in ketosis and on carnivore, then after 16 hours of fasting, i.e. no food at all, you switch on autophagy, or self-eating. And as we've touched on, that's when the immune system goes around and gobbles up all those cancer cells, all those old cells, all those senescent cells that are really just getting in the way of things. And so what I like people to do next is time restrict. So eat all their food within a 6-hour window. Now, the joy of being carnivore is that's easy, because you might get a bit peckish. I mean, so what I recommend people do is have lunch at 12:30 and supper at 6. So you might get a bit peckish in the morning when you think, oh, I could do a little snack now. But if you ask yourself, is the brain working well? Guess what? Yes, it is. Is the body working well? Guess what? Yes, it is. So you ignore the hunger pangs and they go away. If you're really in need of a hit, then have a slurp of MCT oil, which is a pure fat, C8, maybe C10 carbon chains in there. But the point about MCT oil is it needs no digestion. It goes straight from the bloodstream via the portal vein to the liver. And in the liver, it produces instant ketones. And so your ketones levels go very high. You uncouple mitochondria, so they spin away, and mitochondrial little engines that generate energy. And it also stimulates mitochondrial biogenesis, so you make more mitochondria. And the difference between little muscles and big muscles are the number of mitochondria you've got there. So MCT oil is a really good little, clinical tip that you can use to keep yourself. If you think you're running out of energy, it's not going to knock you out of ketosis. It's not going to knock you out of autophagy, and it's going to give you a little hit of energy. It's a bit expensive, but it's worth it.
Yeah, gotcha. And you mentioned muscles before, and I was thinking about, obviously as we're aging, people think, oh, your metabolism slows down, you start gaining body fat. But is it because we're under muscled, or what is it about exercise and strength training that's beneficial?
Well, an inevitable part of aging is we start to lose muscle. So as we get older, we have to fight harder in order to maintain that muscle. If you do nothing, then of course it's going to waste away. And so as we age, our requirement for protein increases. So with age, we should be eating a higher protein diet, and we should be doing more. We should be doing exercise. Now, it's all about the right sort of exercise. So just going for a long walk is not going to cut it. We need to be a little bit more disciplined about doing workouts at least twice a week. And they don't have to be long, they don't have to be protracted, but it's the old story, no pain, no gain. So it has to be the sort of exercise that makes your muscles really ache and scream. And, isometric exercise like planks, like press-ups, like squats, maybe doing some weights. And there are some on YouTube, I would love YouTube. It's like Open University. You can put in any question there and you get fantastic answers from delightful people who are giving their time for nothing. And there's a whole range of trainers who explain exactly how to do them, how long for, what to expect. And the remarkable thing is how little you need to do to stay well and stay strong. And staying strong is important, because if you get weak, you fall over and fall over. If you fall over, you break things. And when you break bones, you die from fractures and the complications of. So staying strong is really important. But set aside, at least 20 minutes twice a week to really go through every core muscles, arms, legs, and make sure they're all screaming and in pain, and that's a great start. And then high protein diet, adding creatine is often very helpful. So another thing I do is I'm very lucky. I've got a wood burning stove here, so I have all my bones bubbling away on in a pot there. So I have bone broth, a cup of that every morning. And again, a cup of bone broth doesn't break a fast, so I can do that safely. And I dollop in there some creatine. And one of my other favorite multitasking tools is MSM. I put a little bit of methyl sulfonyl in there, and I slurp that back. And I'm hoping that's going to keep my muscles and tendons strong and frictionless, so I can continue into old age, staying well and functioning to a high level.
Awesome. Yeah, that's great advice. I was curious about, if someone came to you and said, look, I need to lose weight, what sort of foods would you recommend they eat? And do people need to track calories?
Okay, no, don't count calories. That doesn't work. Because weight is a hormonal thing. It's not a calorie thing, it's a hormonal thing. And the joy of being on a ketogenic diet or a carnivore diet is the satiety hormones appear early on. So you start to eat, and the key is eat slowly, chew your food, don't gobble it back, and that produces the satiety hormones, the leptins and the ghrelins that says, you're full, you don't need any more. And guess what? So you don't need any more. So the first start is to get into ketosis. And many people have never been in ketosis. They spent their whole lives having 3 meals a day and snacks between, and they've never been in ketosis. And so if they try and fast, it's agony for them because their blood sugar goes low, they can't fat burn, and they feel dreadful. So for weight loss, the first step is get into ketosis. Second step is toughen up on the diet. So your ketones, so nutritional ketosis, you're running between 0.5 and 1. For weight loss, you need to be between 1 and 2, really, and maybe nearer 3. And at that point, you time restrict eat. And that may be all you need to do to lose weight, because you just don't get hungry. I mean, being in ketosis is nature's way of doing, these horrible Mounjaro and Ozempic drugs, which we know do not have long-term benefit and are killing people. Those drugs are an absolute disaster. Ketosis is nature's way of achieving that. So you don't feel hungry, so you can do with less. And sometimes you have to do longer fasts in order to start the weight loss. But counting calories doesn't work, because if you count calories, the body simply says, oh dear, we're in starvation mode, we'll stop burning calories. And if you stop burning calories, that just makes you cold, tired and depressed. That's no fun at all. So don't count calories. It doesn't work. Get into ketosis and do intermittent fasting. And again, just building up your muscle mass is very helpful, because you burn very few calories by going for a walk or going for a run. People think they can burn off calories doing that. You can't. It's minimal. But if you increase your muscle mass, you increase your basal metabolic rate. You increase the calories you burn off just at rest, doing nothing. And that's always very cheering. So make sure you're in ketosis and intermittent fast, and that does 99% of it. If anybody wants to watch, have any more details of this, there's a lovely doctor called Dr. Mindy Pelz, Pelz. And she does lovely YouTube videos with good graphics explaining how fasting works, how autophagy works, and how as you fast, the point at which you start to kickstart weight loss, the point at which you reset the gut, the point at which you reset the immune system. And that's all very good for morale when you're doing a long fast and thinking, I'm feeling hungry, I want a snack. It helps. Knowing all this stuff from Dr. Pelz helps you stick with the regimes.
Awesome. And how do you measure the ketones?
Well, you can do it in 3 ways, because the main ketone that we burn is beta-hydroxybutyric acid. And then there's other ketones, there's acetoacetate, and then there's acetone. Acetone we exhale, and that's what gives you the acetone breath, and there are breath meters you can use. We pee out the acetoacetate, and that gives you a clue. But really, the best measure is to do bloods. And once you've done a few bloods, you get a pretty good idea of where you are. So you don't have to keep testing all the time. There's a wonderful doctor in this country called David Unwin, GP, works up in Southport. He has reversed over 140 cases of type 2 diabetes simply with a low carbohydrate diet. And that's just in his own practice. Now he's working with Abbott to develop continuous ketone monitor. Now that hasn't arrived yet, but when it arrives, that will be a game changer, because that will help people so much. We've already got continuous glucose monitors, and again, they're very helpful for people wanting to become keto adapted. They cost about 60 quid, which is, I'm not quite sure what the dollar exchange is in Australia, but you just put them on the arm, and that measures your blood sugar continuously for 2 weeks, and that gives you a really good idea of which sugars are spiking your blood sugar, because sometimes allergies to foods can manifest by spiking blood sugar. So it gives you an idea, it gives you a bit of a handle on that. So it's a very useful adjunct to, am I doing the diet, well enough, tight enough? And people often find that helpful. But when we get the continuous ketone monitor, that will be a game changer. Looking forward to that.
Awesome. Yeah, I need to look into that. In terms of hydration, if someone's having like water and like a high quality salt, like a Celtic or a Baja Gold sea salt, is that enough?
You need 3 things to hydrate. You need, yes, water, yes, salt, but also fat. Because without good quality cell membranes, you can't retain the fluid within tissues. So you need all 3 of those things. And of course, for good fourth phase water, as we touched upon, you need heat. This is why our bodies run at 37 degrees centigrade. Because if you get cold, then the quality of exclusion zone water declines. You get more friction in the body, and friction equals inflammation. They're inseparable. So keeping warm is really, really important. And that's all about energy delivery mechanisms. And an important part of that is the thyroid. And the underactive thyroid is a very common problem. So with all my patients, I always want to know what their body temperature is. Should lie between 36.9 and 37.3. If your core temperature is consistently running much lower than that, then that suggests you've got poor energy delivery mechanisms, and we need to look at, and that's the subject of another long lecture, I'm afraid, how we can improve that. But in a nutshell, for good energy delivery mechanisms, you've got to have the right fuel in the tank, and that's ketones. You've got to have some oxygen, obviously, and then my favorite subject, mitochondria. I published 3 papers about mitochondrial function, 15 years ago, and mitochondria are the engines of our car. So every living cell in nature, my dog, the sheep out there, and the horses, they're all powered, even that grass and that bracken, they're all powered by mitochondria. And mitochondria obviously need the right fuel in the tank, ketones. And they also need a few raw materials like CoQ10, magnesium, vitamin B3. And then our bodies need the thyroid accelerator pedal. That determines how fast mitochondria go. And the adrenal gearbox, and that allows us to gear up in response to stress and demand. But if the thyroid accelerator is set low, then a mitochondria goes slow. And if a mitochondria goes slow, then our basal metabolism is slow. So we're not burning calories at rest, and we're running cold. And when we run cold, everything goes slow. The liver goes slow, the brain goes slow, the heart goes slow. We age prematurely. The immune system goes slow, and that's going to be a risk factor for cancer, dementia, and heart disease. So this is why getting the thyroid right is so important. And it's, generally speaking, the underactive thyroid problems are very badly managed by doctors who often underdiagnose it, and then they undertreat. I've actually written a book about this. I've been very naughty. I've called it the underactive thyroid. Do it yourself because your doctor won't. And the shameful thing is that is the case. I will send you, Todd, the early chapters so you can get that flavour of what it's all about. And if you want to do a session on thyroid, we can do a session on thyroid.
Yeah, I definitely want to check that out. I have to send my parents a copy. Yeah. Sarah, what's the best place for people to reach out to you?
I have a website. I put all my information on the website. I wish I could put all my books on the website, but my publisher won't let me because she's trying to sell a few books, of course. But the important chapters are there. I just checked the other day. It's had 35 million hits, so it's obviously useful to somebody. And there, the basic information is there. If you want to attend a workshop, I run workshops online where I chat away all day. So I've got one tomorrow, for example. I've got some Australians joining me tomorrow. I know that. And then anybody can ask me any question at any time. So it's quite interactive, and no two workshops are the same. And then, of course, for people in this country, I run weekend workshops. So people come here on a Friday night and I talk all day Saturday and Sunday and Monday. And then, of course, I've got several books that I've written on the subject. So, I've got to the age where I think I know enough that it's worth teaching, and I do enjoy the teaching. I do enjoy the podcasts. I do enjoy the Zoom online sessions. So we have fun doing that, and I hope people go away having learned something that's useful to move on their particular health journey.
That's awesome. Excellent. Thank you so much for your time today, Sarah. Thanks for sharing your knowledge with us. I really appreciate it.
My pleasure. I'm sorry it's gone a bit dark in here. I should have turned the lights on before we started, but I didn't think ahead.
Thank you so much.
Okay, Todd. Bless you.
Cheers. Thank you.
Okay, bye-bye. Bye-bye.